All right, good afternoon. Mike, can you hear us?
Yeah, I can hear you. This is Mike.
Excellent. And Rob, are you also there? If we could put Rob up on the screen and Mike.
I think Rob may be having a connection difficulty. They've had a number of communications outages in the last few hours. So
Okay. So
we'll
maybe,
confirm.
Mike, we'll get underway with you, and then Rob will join in, hopefully join in progress, if that's okay. Yeah,
Absolutely,
I will.
absolutely.
Great. All right, good afternoon. So we're delighted to be joined by colleagues from the World Health Organization. We have with us Dr. Mike Ryan, the Executive Director of WHO's Health Emergencies Programme, and he is in Geneva. And with some luck, we should have Rob Holden, WHO's Senior Emergency Officer, who is joining us from Gaza, but I do know we have some problems connecting Rob. They will obviously be talking to you about the situation of the health sector in Gaza and the recent evacuation from Al-Shifa. So without further ado, Mike, you go ahead, and hopefully Rob will join us.
Great. Good afternoon, everyone. I presume it's just about hit the afternoon there. And pleasure to join you, and thanks for the opportunity to brief you on the health situation in Gaza, and around the region as well. We've been tracking both the deaths and fatalities in Israel and the occupied Palestinian territories, both in the West Bank and in Gaza. Today, I'll focus on the Gaza situation, but that in no way uh, detracts from the death and suffering that's occurred in other places. And might I say, on World Children's Day, where so many children have died, and so many children still remain in danger, many children are still hostages, that on the day in which we celebrate the Declaration of the Rights of the Child, that we think very hard about the situation we're in, and absolutely try to find solutions to ease the suffering and pain of all people affected by this conflict. And with that in mind, I will focus on the situation in the Gaza Strip. We've had great difficulty in updating the detailed disaggregated numbers that we've been providing to you all over the last number of weeks. The estimates for fatalities and deaths at this point is very unclear, but it continues to rise. There is no question of that. The last verified numbers we had were last Friday, which was just over 11,000 fatalities. But it has certainly risen to then, and the ministry since then, and the Ministry of Health in Gaza have reported obviously much higher numbers of that, and we will continue to try and get back to having more detailed disaggregated data. But again, this is one of the unfortunate things that happens in a situation like this, where health systems are collapsing. It is very hard to maintain good data. The vast majority of people who've been killed are women and children, and there are still large numbers of people missing, and this could include up to 1,500 children. The health system in Gaza is under extreme pressure. The vast majority of health hospitals are closed. There are only 10 of the 36 health hospitals that were functioning in Gaza now functioning in any way at all, and even they are struggling to function. Almost all of the health facilities in the northern part of Gaza, north of the Wadi Gaza line, have ceased functioning as hospital facilities. And at this stage, obviously, you've seen and watched the unfolding situation at Al-Shifa Hospital, but there are also other facilities like the Indonesian hospital, which are now coming under extreme pressure as well, and may need, and the health staff there may be requesting some form of evacuation in the coming days. The scale of injuries, the need for supplies, the inability to move around within the strip, and the inability to do that safely has placed huge strains on all of the UN community and NGO community to serve the people on the ground. Beyond the risks of direct wounds and injuries, which are very severe, we're seeing large numbers of people packed into refuges, packed into UNRWA schools, packed into various other kinds of centres. This is creating a concentration of people, which is driving epidemic risks. And the rains over the last 24 hours have really added to that. There really has been heavy rain. It has flooded a lot of the makeshift camps, and it is generating all kinds of risks. And it's not just the risks of diarrheal disease. The sudden drop in temperature is going to create a problem with pneumonia in children, the stress that those kids are under, the nutritional status that those children have, make it a recipe for epidemics. This is an absolute recipe for large-scale epidemics amongst this population, and that, as a public health risk, right now will begin to approach the same level as the injury crisis that we have and the crisis in the hospitals. Nutrition in itself is a major challenge, and our colleagues in WFP, I'm sure, have briefed you. But nutrition is the baseline for health. Nutrition is the baseline for child development. And right now, the calorific intake and the quality of that for children particularly has reduced below a critical level. So a lot has been done to try and address this. A lot has been done to try and bring in supplies. But frankly speaking, many of the health workers themselves have become displaced, and maintaining the existing health system. Before this crisis, we had approximately 3,500 beds throughout Gaza available to serve patients. Now that is less than 1,400. And many of those 1,400 beds are now difficult to support with supplies, difficult to support with health workers, and becoming increasingly difficult to sustain going into the next few weeks. Our biggest fear at the moment is also a shift or another movement of patients. 1.7 million people have already been displaced. There is a real risk that many of them will be displaced again. And again, the further concentration of people in ever smaller areas pushing out to the West Coast is only increasing the risks to those populations, be it from injury, but more importantly, be it from the public health risks. So we really do need to take a step back here, understand the risks that are being taken, and hopefully have a ceasefire, hopefully have all of the hostages released, and hopefully get to a position where we will have unfettered access with our UN partners and NGO partners to support all people affected in this crisis. With that, I will hand back to you. I don't know if Rob has managed to join.
Yeah, I think he has. I don't know if his camera is on, but I think we do have you by phone. Rob, can you hear us?
Yes, I can. Can you hear me?
Yes, perfect. I know we don't have any video of you, but we can hear you loud and clear. So if you want to go ahead and just kind of describe the situation, what's happened with the evacuation over the last 48 hours, that would be great. Thank you.
Thank you, and apologies for joining late. And many challenges down here with the ability to communicate and use internet. And thank you for this opportunity. So, as Mike has said, quite a desperate situation for the people of Gaza. And one area we focused on this weekend over the last 48 hours is to try and move is to go up to Shifa Hospital. So an interagency, a UN team led by WHO visited Shifa Hospital both on Saturday and Sunday. First was to assess our ability to actually get to the hospital, given that this is still a very active conflict zone, particularly in and around the vicinity of the hospital. To speak, once we got on site on Saturday, we wanted to obviously connect with the medical staff and understand with greater clarity the challenges that they were facing, they are facing, and understand what their priorities were in terms of how we might, as the United Nations, in support of them and in support of the Palestinian Red Crescent, provide some support. They asked at that time for the evacuation of some of the most critical critically ill patients. In particular, we had 33 neonates who are very, very sick. Indeed, between Saturday and Sunday, 2 more of those babies died, and we were asked as a matter of urgency and priority whether we could help facilitate the relocation of those babies from Shifa Hospital to a hospital in the south of Gaza. We were grateful that we were able to do that, support that request, surely by the bravery and the help of the Palestinian Red Crescent Service and their ambulance drivers. So on Sunday morning, the UN facilitated the convoy of 6 ambulances up to Shifa Hospital, and over the course of 2 hours, we were able to load our ambulances. We were also able to bring with those babies some of the medical staff that had been looking after the babies so that they could provide continuous care, both from Shifa Hospital on the journey south and into the receiving hospital in the south. And we also brought out family members of those staff. And we brought those babies south yesterday afternoon, and they were immediately taken into a pediatric intensive care unit where the medical handover was done and the appropriate level of care was initiated. We do plan to go back to Shifa in the coming days. There are a number of patients in the hospital that are in a life-threatening condition. We have a number of people who are on hemodialysis that are not receiving treatment and have not received treatment for several days now. In addition to that, we have one gentleman who is in intensive care and needs to be transferred. And then we have 25 patients with severe injuries to their spines that we are going to try and help facilitate with the PRCS, with the Palestinian Red Crescent Service and their ambulance service. We're going to try and help facilitate the transfer of those patients to hospitals in the south. The remainder, about 220 patients and a number of staff, we're still looking at how we provide support to them in situ. Of course, it's a very complex environment. It is, and as I was saying at the start of my brief, a very active conflict zone in and around that hospital, and it's complex to remove that number of people, and it would have to be done with very careful planning over a period of time. So, whilst we do that planning and thinking of what more we can do for the patients in Shifa, we are trying to negotiate to ensure that they have access to adequate food, access to adequate safe water, and access to continuing flow of medical supplies and access to fuel, so that we can keep the generators running and keep some of the lights on, and obviously keep the one operating theatre that has some capability and is limited, that we can keep the lights in the operating theatre. But that's difficult. Just before I close, yes, there's a lot of focus on Shifa Hospital in north of Wadi Gaza, but it's not the only hospital that requires urgent attention. We've heard the reports today of the Indonesian hospital, and we've also... Can you still hear me?
Yes, go ahead.
Sorry.
Yes, go ahead.
Can you still hear?
Yes, go ahead.
Sorry. We've also got reports of a very critical condition at Al-Harabi Hospital. Now, this was one of the first hospitals that was struck at the early on in this conflict. That is no longer a functioning hospital. There are no staff there, but that is now the place where many people who may survive the initial trauma, if they can get to that hospital, that is now just a collecting ground for trauma patients. We are looking at how we might go and assess that situation in the coming days. And the other thing we're looking at, it's not just about evacuation of these major hospitals. These major hospitals are still the only hospital, albeit their lack of ability to function for several 100,000 people, are still left in the north. So it's not just about how we evacuate. The question is actually how can we resuscitate these hospitals to continue providing services? Obviously, in the current context, that is difficult, and we do need to get patients who require urgent and critical care to that care. But at the same time, we're thinking and planning and trying to work through how do we actually continue to provide services to the population that remain north in those hospitals. But that's going to take some further detailed planning. Back to you.
Thank you very much, Rob. If you could just let us know where exactly in Gaza are you briefing us from?
I'm currently based in Rafah with the UN interagency team in Rafah.
Perfect. Thank you. Pam?
Steph, and thank you, Dr. Ryan, and thank you, Rob. It's Pamela Falk from CBS News. Could you give us a little more granularity about the evacuation from Al-Shifa Hospital? In other words, a lot of the reports said, and our reporting said, that some of the premature babies went to Egypt. How are they doing? And was there help? Did the IDF help evacuate? Did the Egyptians help evacuate? How did it work? And thank you very much.
Thanks, Pam. It was a very broken line, but if I understood correctly, and forgive me, if I understood correctly, it's about how the babies are doing now and the current location of those babies. Is that correct?
Yes, except also did anyone, the Egyptians, the IDF, did anyone help the evacuation from inside Gaza? Thank you.
So we'll start at the Shifa end. There was very close coordination with the IDF. There was very close coordination back to authorities, and we coordinated and they facilitated our entry into Shifa and our exit from Shifa. On the babies, they did well overnight. We'd passed away on the Saturday night. We went back yesterday morning. All the babies survived the journey south. The babies received very good care overnight. And this morning, there was a transfer at the request of the Ministry of Health in Gaza, the de facto Ministry of Health in Gaza, to the Egyptian government. There was an agreement for the transfer of those babies, initially by the PRCS, by the Palestinian Red Crescent Society, and there was a handover at the border to the Egyptian Red Crescent Society and entry into the healthcare system in Egypt. So it was 28 of the 31 that travelled. The remaining 3 not travelled because their mums and their families came to the hospital yesterday, and those babies were reunited with their families, which was just fantastic news to wake up to this morning. Thank you.
Thank you. Sharife?
Thank you so much for the briefing. As WHO has been on the ground and has also sent teams to the Al-Shifa Hospital, we know that Israel is claiming that Hamas has used it as a military headquarters. I'd like to find out about your observation. Have you seen evidence that the hospital is being used as a military headquarters? Thank you.
Our focus there was Mike, do you want to take that? Did I just hear you jump in? I can take that.
Please go ahead. I will supplement though.
Okay, thank you, Mike. I'm sorry if I'm sounding hesitant. It's a really badly broken line, so forgive me. So our focus when we went to Shifa Hospital, we did go inside the hospital. Our focus was on the patients. Our focus was with the doctors, and trying to understand what we needed to do to be able to help help support the transfer of those babies. So that's what we focused on. We only saw civilians in that hospital, and that's all we were focused on, with the doctors, with the nurses, with the patients. So that was our focus of the hospital, and we were very part of the hospital. It's a very big complex, as I'm sure you're aware, and that's all we focused on, and that's all we saw.
Thank you. Maggie, Joe, then Nabil.
Hello, it's Margaret Bashir from Voice of America. Thank you so much for the briefing. And could I just ask you a little more detail, Rob, about the Indonesian hospital? The foreign minister of Indonesia said that they cannot reach 3 Indonesian volunteers who work at the hospital. Do you have any information on the status or the situation of the staff or people in the facility? And is it you're saying some of the hospitals are kind of still there but not really working. What can you tell us about the status of Indonesia? Is it working? Is it receiving new patients? Is it just kind of hunkered down and trying to help the people it's got? What more can you tell us about it? And the same about Shifa. Is it taking new patients then? If you said that they have a lot of 220 patients still there, it sounds like it might. Is it taking any new ones? Are any hospitals taking any new ones in the north, I guess?
All right. Sorry, I didn't get your name, but thanks for the question. Again, it's a very broken line, so if I miss any of your questions, please, we'll just come back to them. Let me start with Al-Shifa. No, it is not taking any additional patients and hasn't done for several days. The caseload that is there is now the residual caseload. This is a 650-bed hospital. And that until people fled or self-evacuated from the hospital in the last couple of weeks, had over 1,200 patients. It was at 200% or almost 200% capacity, and the main receiving hospital for north of Wadi Gaza, for the city of Gaza. But no, it is not. I repeat, not taking new patients. And hasn't done for some time. On the Indonesian hospital, we've seen the reports. We've been trying for much of the day to get a communication line into the Indonesian hospital. We have been in touch with the foreign minister, as you said, from Indonesia, because of the Indonesian nationals that are working there. We currently know that there are 700 patients and staff within that hospital. We've seen the reports, as you have seen the reports of what has gone on, what has claimed to happen in that hospital. We've no direct information from anybody inside that hospital of the current status. We know there's intense fighting in the area and in close vicinity to the hospital, but that's all we've got at this time. But just to reiterate, we are trying to get a communication line into the hospital to find out the status of the patients, find out the status, so work out what, if any, support we can give at this time.
So could I just ask you a quick follow-up then? If someone in northern Gaza is injured or sick, which hospitals are still available to them to go to seek help?
Obviously, depending on their immediate location. The honest answer in terms of what you and I would see as a functioning hospital, none, virtually none, are providing a level of care. When you talk about a hospital of what you expect it to do, many of these now hospitals are non-functioning. The Indonesian hospital was partially functioning until this morning. We don't know its current status in terms of whether it's accepting. We believe it's not accepting new patients. We believe that staff there will continue to provide care in line with their available resources. So that is partially functioning, but not receiving new patients. Shifa, the few staff that remain, continue to provide the best level of care they can, again, within available resources, but is not receiving new patients. And Al-Harabi Hospital is a non-functional hospital. There are no staff at that hospital, but that is the main hospital now that seems to be the one that people are going to who are seeking urgent medical care, whether it be trauma-related or they've got cardiac problems or other ailments that require hospitalization.
Joe?
Maybe I could supplement there with some more general information regarding this issue of functionality of hospitals on the north of the Wadi Gaza line. there were 24 facilities, hospitals north of that line. 21 of those are now entirely dysfunctional and only 3 partially functional. There were only 11 facilities south of the Wadi Gaza line before. Before this conflict, there were 3,500 beds in Gaza. The vast majority of those beds were centered around Gaza City, and particularly around big hospitals like Al-Shifa and the Indonesian hospital. The Al-Shifa Hospital has been there for 75 years and has been the absolute backbone of health service provision in Gaza over that time. It provides the reference services, the cancer services, dialysis services, trauma services, reconstructive surgery, all of the complicated stuff you would expect at a very high-powered reference center. In the south of Gaza, it's much more simple hospital infrastructure, like districts hospitals, community hospitals, like many of you would have in the States. They do a good job, but they're not there to deal with these complicated cases. They don't deal with complicated trauma. They don't deal with complicated cancers. They don't deal with complicated childhood illnesses. So those 11 hospitals in the south, only four are non-functional. About 8 are still somewhat functional. And we are in a situation where we now have 1.7 million people displaced. So we have twice or 3 times the population in south of the Wadi Gaza line, using 1/3 of the hospital beds in less than 1/3 of the hospitals available. So even if tomorrow morning this were to end in terms of the ceasefire, we still have a huge problem on our hands. We've got a huge demand from the existing injured. We've got a huge potential demand on the system. 5,500 women are going to give birth in the next month. 15% of them will need a cesarean section. 25% of their children will be born preterm. That is thousands of babies. That's not 31, 29, or 38. That is literally thousands of babies will be born who will be preterm and will need those incubators, will need that kangaroo care, will need their mother with them to be able to provide that. And some of them will need intubation, some will need mechanical ventilation. There's over 1,000 patients on cancer therapy. We have thousands of diabetics, thousands of people with severe hypertension, the normal things of life. We have 20,000 people in need of urgent psychiatric care. The only psychiatric hospital has been closed as well. So we are seeing a complete collapse of the higher level infrastructure of the Gazan health system. It is just the most basic of needs that can be met now. And remember, there has been no water, no electricity, almost no fuel provided for those, and very limited medical supplies going in. These hospitals have not had access to the basic things they need to provide healthcare services. And as I said, as Rob said, the number of hospitals in the north has collapsed. There are still a significant number of people up there, and there's things we will have to do to see how we can continue to provide a basic level of care through Palestinian doctors and nurses for them. But the vast majority of the population is now in the south, and we have real concerns if that population is further pushed to the west now through Khan Yunis, given the announcements of imminent military operations. We're going to see a further concentration of people onto the west coast with an approaching winter, with no shelter, with no facilities close by to them, and we're going to see a further tragedy emerge, particularly with the public health crisis that will emanate from that situation. So the hospital situation, the primary healthcare system situation in Gaza is catastrophic, and it is the worst you can imagine north of the Wadi Gaza line.
Nabil and then Mike.
Yeah, Joseph Klein of Canada Free Press. First of all, I want to commend you on the life-saving work you're doing under very trying circumstances. But I have a follow-up and then my main question. Rob, I know you said that obviously your main mission in entering the hospitals was to do your life-saving work, focusing on the health needs. But are you saying that, to your knowledge, there weren't even any mention by any of the hospital staff at Al-Shifa of the presence of armaments like AK-47s, rocket-propelled grenades, and other weapons that were found inside the hospital? So that would be my first question. I just want to confirm that this didn't come up at all in any of your interactions with staff. My main question is, if you could tell us what medical equipment, like incubators, medicines, etc., if any, did Israel provide for the preterm babies and other critically ill patients? And were there any medically trained personnel that Israel provided to assist in the Al-Shifa Hospital attempt to save lives? Thank you.
Sorry, I'll try and answer that again. I'm having to read it because I'm probably here having give third or fourth word. So again, yeah, just to confirm, our focus was with the doctors and on the needs and doing a medical assessment. We had a very strict time limit on the ground. We were very focused on our task, as was that, as were the doctors, the nurses, and other staff in that hospital. So, we had no discussions. We saw no evidence, and other than our focus being on those patients. We didn't go there to investigate or assess anything else other than what is it we could do to provide a level of support to those who are most in danger of losing their lives. And that assessment in terms of who that cohort of patient was made by the clinicians. And yesterday the priority was to remove those babies. We focused on that alone. That was enough of a task in a very, very high threat environment with active fighting going on outside the walls of the hospital. That was our focus. That was the focus of the medical staff. That was the focus, and that's it. So we didn't get drawn into anything else. We've no interest in anything else. Our job was there to provide a life-saving capability, which is what we did. In terms of support, again, of what Israel did or did not provide, that wasn't the focus of our conversations with the medical staff. The focus again, and I reiterate this again, was how we would move 31 critically ill babies whilst essentially under fire in 6 ambulances through a war zone, keep them alive, and hand them over to the specialist care that they required in the south of the country. We didn't go there to assess what the Israelis had done or hadn't done in terms of providing support to that hospital. So that that's what we focused in on. Our job was to get in and get out safely, and to bring those babies out alive, and to give them the best chance of survival once we got them south, and that's what we did.
Thank you. Nabil, Mike, and Linda, and then I think we'll let our guests go.
Thank you so much. Nabil Abisab, Al Arabi TV station. My question is to Rob. Can you please tell us who's your counterpart on the Israeli side? Are you communicating with a political level or the military level in Gaza? And how long it takes you to get clearance to send an envoy, for example? How long it took you to get the clearance to evacuate these children from the hospital? Also, another question. Do you think that it is possible to deploy field hospitals in the north? Some countries volunteered to send field hospitals. Is this doable in the north? And another question to Mr. Ryan in Geneva. Are you documenting this situation and these cases and your operation on the ground? And are you planning to report on the situation to the Secretariat or maybe the Human Rights Council, or I don't know, other bodies in the UN system?
You want to go ahead?
Okay, thanks. Okay, thanks. Yeah. So on the liaison with parties to the conflict, there is, as I said at the start, this WHO led this mission, but ultimately this was a United Nations mission, and there were a number of agencies that made, that enabled this mission to happen. First is the Office for Coordination of Humanitarian Affairs, or otherwise known as OCHA. Then we have UNRWA, we have the Mine Action Service because of the UXO threat. We had Department of Safety and Security, we had UNICEF, and that was the team. The negotiation with the parties to the conflict is actually done by a specialist unit inside OCHA. They have a civil military coordination unit, so the liaison in terms of gaining permissions to go into the area of operation was led skillfully by the team in OCHA, both here in Gaza and the team in Jerusalem. So they are responsible and have the right level of contact and coordination at various levels within the Israeli Defense Force. Once we start the operation on the ground, we have then contacts. We are given contacts on the ground, so that as we get to certain junctures, because it is a heavy conflict zone, we are in touch with operational commanders on the ground, and we have contact with operational commanders on the ground of how we enter certain phases of an operation. Whether we go this street or that street, everything is choreographed, and we stick to that plan as agreed by the IDF. How long did it take to plan the mission? The first mission going up on Saturday, we took 48 hours to plan. That was our planning timescale, because we wanted to make sure that we had a very tight, very sound plan that we had confidence in. So it wasn't just about negotiation and coordination with the parties, but we also had confidence in our own team, in our own capabilities and our own equipment, particularly our communication equipment. So we took 48 hours to plan it. We came back on Saturday night. We got back into Gaza around about 7 o'clock in the evening on Saturday evening. We did the planning overnight. We got very rapid approvals from all sides, and we left back to the north at 0600 the next morning. So we planned it overnight and got all the approvals from everybody we needed to get approvals from overnight. So it happened very quickly.
Thank you very much. Mike, then Linda.
Jen.
Can I just answer that?
Sorry, Mike.
Yeah,
Mike, go ahead, please. Apologies.
And just maybe to follow up on Rob's, we are grateful for the cooperation and deconfliction we got on these particular missions into Al-Shifa, but that has not been the case as a constant. It has been exceptionally difficult to put in place a proper notification, acknowledgement, deconfliction system, and we have been operating for weeks without that system in place and without that cooperation necessary to run humanitarian operations in a conflict zone. Ceasefires are the best way to do this. When there's no firing, you don't need to deconflict. When there's active fighting and active engagement, you need to have zones and routes where you can deconflict the specific route, the specific action, the specific mission. That requires a dynamic engagement, and the engagement between us and COGAT, which is the Coordination of Government Activities in the Territories, COGAT, that is the main body that we deal with as WHO and the UN deal with. And that has been subpar, to say the least, and has not been efficient. And certainly we've worked in many, many different war zones, and this has been a very difficult process to have that efficiently in place and get those necessary deconflictions in place. And many of our staff are operating in situations where there's been no deconfliction of their missions, delivering supplies and other things, really not knowing what might happen next. So that must improve, and we are grateful that it did improve for the Al-Shifa mission, and we hope that becomes the new standard of cooperation. We are grateful for every, as Rob says, we take every opportunity we can, and we're grateful for every single facilitation we get from any side of the warring parties, because our sole objective is to provide assistance to people who are suffering on all sides of this conflict. With regard to documenting events, we are constantly documenting activities. We are certainly documenting many attacks on healthcare, over 150 attacks on healthcare in Gaza alone, but there have also been attacks on healthcare in Israel. There have been attacks on healthcare the West Bank as well. I don't have those numbers exactly to hand, but I'll get back to you with them later. The issue is that this is underpinned and supported by two resolutions. A resolution of the UN in New York, which is a resolution on the protection of civilians and healthcare settings in war. I think it's resolution 2286. And then it was 2016 and a resolution of our World Health Assembly in 2015, 6520. They mandate that WHO should collect and verify all information related to attacks on healthcare and publish that information, but also to report that information back to the Secretary General, the Secretary General's office, and it is the Secretary General's office who would then task any other bodies, such as the ICC, to investigate. We are not investigators. As Rob said, we are not forensic scientists. We are not criminal investigators. Our job is to document the occurrence of an attack on a healthcare facility, person, or object, to document the impact that that has had on the health facility, the health workers, or the patients, and to report that publicly through our SSA reporting system, and to report that regularly to the Secretary General's office. That is what we do, and we continue to do that reporting both to the World Health Assembly and to the Secretary General's office. So with that,
2012.
okay. So with that, I'll hand back.
Thank you. Mike, then Linda.
Thank you, gentlemen, for taking the time. Rob, you had mentioned, I'm not quoting here, that the procurement of food, of medicine, of fuel necessary for taking care of those in the most precarious positions is being negotiated. Is that being negotiated with COGAD, with Israel at large, with Hamas? Who is that being negotiated with, the procurement of those provisions?
Sorry, I didn't get the question at all. Sorry.
Yeah, and
I heard my name mentioned. I'm literally not getting every 10th word.
I'm sorry. I'll unless Michael has an answer, but the procurement of the food, the medicine necessary for those in bad health, is that being negotiated with Israel, with Hamas? You said it's being negotiated, but I don't know who it's being negotiated with.
So the fuel issue, I think, has been well documented. The challenges we've got of bringing and being allowed to bring sufficient quantities of fuel in to provide the necessary fuel to essential services, whether that be in hospitals, be it clinics, be it water salination plants, water treatment plants, so on and so forth. That's negotiated with the Israelis at a high level in the UN system on behalf of the system. So there's high-level negotiations going on with the Israeli government to advocate to have a adequate and sustained supply of fuel to allow essential services to function and to allow the UN and its partners to provide the scale of operation and provide those services in support of the Gaza people, a high level of fuel on a daily basis to provide the aid where it's needed.
So there's no request of Hamas in terms of providing fuel or food or medicine? It's only being run through Israel?
Rob, can you hear us?
I have no information whether Hamas. Yeah.
Okay. Thank you. Linda, please.
Thank you. My question is this. A few weeks ago, the Israelis pretty much ordered Gazans in northern Gaza to go to the south. I was wondering, at that juncture, did Israel also allow, would call and would permit the young children from hospitals or people in the hospitals to also leave and go to the south?
Rob? Yeah, Sorry, I didn't hear I heard nothing. I've heard nothing
All right,
in the last
say
30
quickly?
seconds or so.
we'll try very short
Yeah.
to the point.
My question is, when Israel ordered Gazans to go from the north to the south, did they also allow the hospitals to, to send sick people to the south as well?
Okay, I think we'll
Maybe I could, maybe.
Yeah, go ahead. Yeah, Mike, go ahead, please.
It's important we have an answer here, because I don't want it to be interpreted incorrectly. The movement, there have been orders for evacuation from the IDF for going back weeks, and the population. And let me remind you that the actual the premise for that was that there would be safety in the south, and that has not been the case. In fact, the most intense bombing over the last couple of days has actually been in Rafah, in the furthest south governorate of Gaza. Over a third of all the deaths have been south of the Wadi Gaza line. Over a third of all the injuries have been south of the Wadi Gaza line. So the south has been bombed and very, very extensively. So many people who were ordered south, obviously they decided to stay where they were because there was bombing everywhere. They were in their homes and there was nowhere to go to. The shelters were full in the south. So I'm assuming people made a decision for those who didn't move. Some people did move and increasingly have moved as the situation has got even worse. The orders to evacuate the hospital are a different thing. Again, as I said, the vast majority of the available sophisticated beds that could actually care for people at the level they needed to be cared for were actually north of the Wadi Gaza line. So the care of those babies, the care of oncology patients, the trauma care, reconstructive surgery, many of those services are either only available or mainly available in those major hospitals in the north. So it was the order to evacuate. Number one, there were thousands of patients there. At one point, I think Al-Shifa had over 200% occupancy, probably over 1,200 people in beds, and God knows how many other people in the corridors. So the logistics of doing such an evacuation would have put those patients in huge danger because of the fact that there was nowhere to bring them that could adequately care for them further south. It was their choice. WHO does not make the call on evacuations. Israel ordered the evacuation. It was the choice of the Ministry of Health colleagues, the health workers, to stay and run the most sophisticated hospital in Gaza and other hospitals in the north, and to continue to try to provide the services to their patients. Our job is to support them in trying to do that. And when they did ask for evacuation, and when they did ask us to be able to help them take them out, we've immediately begun to do that. With reference, I was giving you data before. There've been a total of 358 attacks on healthcare in this crisis so far. 33 have occurred in Israel, with the death of 21 health workers and many others injured. In the West Bank, there have been 170 attacks with 22 injured. In Gaza, there have been 152 attacks with 16 health workers killed while on duty, with up to 200 more who've been killed at home with their families in buildings that have come down on top of them or on various other exchanges of fire or artillery. So it is the health system is under massive pressure. We continue to report that, we continue to verify that, and we continue to try and support the system. But in terms of those children, again, the medevac system into Egypt has only begun to function. It's taken quite a while to get that in place and to negotiate the fact that very sick people, including children, can cross that border. So with that in place, there may be an opportunity for an actual accelerated transfer of very sick and wounded patients out of Gaza and into Egyptian hospitals. They have provided thousands of beds, thousands of doctors and nurses, and have really scaled up their capabilities within Egypt to receive, if needed, thousands of critically wounded patients and complicated medical cases as needed. And we've already done that with some very sick children with cancer, working with St. Jude's Hospital and with the Egyptian and with the Jordanian authorities. So I think the movement of children now and very wounded children is going to have to probably be more and more into Egypt. And certainly getting wounded children out of the existing hospitals in the Indonesian hospital and those in the north is going to be a real challenge. Over.
Thank you very much, Mike. Before we let you go, I'm just wondering, because it's a question that's come up, do you have the number of total medical evacuations that have taken place from Gaza into Egypt?
I don't have that number, but I will have it
Great.
for you in a minute or so.
All right, then we'll share it here. Mike, I want to thank you, and Rob, I really want to thank you, and I think on behalf of everybody in this room, just to pass on our best wishes to you and the WHO team in Gaza. Thank you very much.
Thank you.
Bye-bye.
Thank you.